Good evening, everyone. Welcome to the latest Optima YouTube Live. This is a patient education session or a general public health awareness session that we have every month. And this will be there on our YouTube channel as well as our Facebook and Insta channel. We generally try to do it on the 15th of every month. Uh, this month it's got delayed to 18th. But please remember to tune in on 15th. Otherwise also you can um, interact with us on our social media channel and suggest certain topics that you would want us to cover, about which more information or health information is required for the general public. That said, let's start with today's session. So in today's session, we have Dr. Khushboo, a consultant physiotherapist. Thank you, Dr. Khushboo, for joining this session.
Thank you, sir. Thank you for the opportunity.
So today's topic is very interesting because it is a problem which affects a lot of people. In fact, one rough estimate seems to suggest that almost 10 lakh people in India are being affected on a regular basis. However, despite it being a very common problem, unfortunately, awareness about this problem is very, very less, particularly among the general public. And in fact, even among some parts of the medical community, like doctors, awareness regarding myofascial pain syndrome is very less. It is a little bit of a technical sounding name and a mouthful, myofascial pain. But a way in which I explain it to patients is that it is a condition which can cause chronic pain, or chronic means pain which lasts for a very long time. So chronic pain in the muscles. So muscle pain which is there for a very long time. Typically, many people have it in these muscles, in the neck or shoulder muscles. So that pain which never seems to go away. So that is the kind of pain that we refer to when we say myofascial pain syndrome. So myofascial pain syndrome is a common cause of uh, chronic pain, meaning pain, as I said, which lasts for more than 3 months, and it affects a lot of people. And in fact, it can cause a lot of disturbance with respect to how productive people are. It tends to cause increase in sick leave and increase in reduction in the quality of life because patients keep going through pain. However, in the majority of patients, management of myofascial pain is not very complicated. It's quite easy, and uh, that is where actually the physiotherapist is involved. So, with that, I would want to ask Dr. Khushboo to explain about why myofascial pain tends to occur. I mean, what are the causes of this muscle pain or myofascial pain?
Yes, sir. So now for my facial pain syndrome, I would say very common causes or primary reasons are available. So one of the reasons I would say is a muscle overuse or a repetitive stress. So that could be like any sort of activities. Like it can be like keyboard using of the computer for the long period of time, bending forward, long drives, heavy weight lifts, or kind of the gardening. So where the movements are repeatedly doing the same, and that can be cause the muscle strain and can create the muscle stress. So this could be the one of the reason. Can overuse of the muscle can create the muscle strain and can have the myofascial pain syndrome. The
So,
next, yes,
here, if I can just interrupt Dr. Khushboo.
no
So,
problem.
one um, before I ask my query, I would like to remind whoever is watching that please do go ahead and put your questions or queries that you might have regarding persistent muscle pain that you might be experiencing, or somebody else that you know might be experiencing. Or, in fact, if even if you're not experiencing, if you have any doubts about the topic that we're discussing, please go ahead and put it in the comments section, and we will try to answer the query. So you mentioned about overuse of muscles, right? that is something many patients find it difficult to understand. Because when I tell them that, it is because of overuse, they say that, no, most of the time I'm resting. Or they say that I don't lift anything heavy. I just do computer work. But you pointed out very nicely in that diagram that repetitive work of any nature, right? Even, am I right? Even working on a mouse on a computer,
Without
uh, the same thing that you're doing again and again and again.
again.
So that itself can cause muscle sprain and muscle injury. Am I right?
Yes. Yeah.
Okay.
So
So what are the other causes? So it doesn't have to be a
other
heavy weight that you're lifting, or it doesn't always have to be a heavy weight or something heavy that you're lifting or overexerting. It can also be a mild activity that you're doing again and again and again. So that can also cause
pain.
muscle pain or muscle injury. What else can cause muscle problems, Dr. Kushbu?
Yeah, another point I would like to say is the poor posture or the muscle imbalance. So poor posture, when I say that means like we have the different type of the postures irrespective of your standing, sitting, and the walking. The way of using your body that creates a lot of muscle imbalance. So poor posture means here you can see the different diagrams where they are saying the different sort of the poor postures. So in that, so many times the different group of the muscles have become tight and the other group of muscles become weakened. So that imbalance can create the muscle stress, that can create the muscle pain, because the one side of your group of the muscles are severely tight and the other side of the group muscles are not holding the posture in a correct way. So that can create, that is called body mechanics. So that can create also the type of a muscle strain and the myofascial pain. So I would
So
say the, yeah,
So is this bad posture something which can cause muscle pain only when you have bad posture when you're standing, or is it something that can occur while sitting also?
irrespective, yeah, all the types, like whether it's a sitting, standing, or the walking, how you are using your body. If any work also you are doing, whether you are using just the computer, but your position of the use is like forward head postures, and you are using your computer, so that can also the bad posture. So any form, if you are using your posture not in a proper way, that can create lot of imbalance in the muscles, and that can create the myofascial pain.
In fact, there is a previous video in which we had talked about neck pain, and
Discussed,
in
yeah,
which you had pointed out four important things
important things.
that
Yeah.
people should remember when they're working on the computer, when they're sitting in front of the computer, which can help them to maintain a proper posture. I would recommend anybody watching this video to please go back and see that video on neck pain as well, in which these four important factors that you need to remember to maintain a proper posture when you're sitting in front of a system, which many of us seem to be doing nowadays during our job. We tend to be sitting at a computer desk. So that will help you a lot to maintain a proper posture and prevent these kind of chronic muscle pain. What else, Dr. Kushbu?
So another point I would say is a lack of activity or the prolonged immobility. I mean that is like you are physically less active, and your immobility can create the joint stiffness, can create the muscle tightness, and that could be also the kind of muscle tightness and the stiffness you develop with the immobility, that can create also the muscle pain or a myofascial pain. So I would say like proper maintaining the regular activities and the exercise can contribute a lot more benefit towards the strengthening of the muscle. So lack of activity, I would say the another reasons where myofascial pain syndromes are very common.
Uh, I agree. I agree. In fact, there's a very viral photo where they show 1999 how the TV was like very fat and people were very thin, and then 2005 where the TV has become flat and then the people have become very TV has become very thin or flat and the people have become very fat. So sedentary lifestyle is something which is really harmful to us. In fact, a few years back, there was some research which showed how harmful sitting can be. And because of that, there was a new slogan which had come called that sitting is the new smoking. So sitting is as dangerous as smoking a cigarette. It can increase the risk of cancer, it can increase the risk of heart attacks. Along with that, the way we sit, and most of the time, if we are like sitting, we tend to slouch and our muscles tend to become weak. And because of that, we can develop myofascial pain as well or muscle pain as well. Am I right, Dr. Khushboo?
Yes, sir. Yeah, so maintaining the proper postures, the way and the activities can contribute a lot more to get the myofascial pain. Yeah.
Uh, can I keep telling patients that this is basically because of prolonged activity, your muscles have become weak and they've become injured. So, but can injury itself also cause muscle pain, which can last for a very long time?
Definitely, sir. So, if you have any sort of trauma or the recent injury where you have not recovered fully from the injury, and I mean to say, recover means you have not developed enough muscle strength and the stability, and that part is still weak. So, that kind of injury also can create a muscle pain in a long run. So, from any of the injuries, what you have got and not recovered fully in terms of the strength can create the muscle strain. In a long run, in overuse or repetitive stress, can create the myofascial pain.
Okay. So you used one word, repetitive stress, right? So which is something which you mentioned initially itself can cause uh, muscle injury and muscle pain. Along with that, if we see the topic of myofascial pain and muscle pain, something which seems to come up again and again is also mental stress. So, stress has increased a lot in modern day, and in fact, the World Health Organization says that we are at the tip of a mental health epidemic. So, levels of anxiety and levels of stress are the highest that they have ever been. So current generation, especially those in the work who are in jobs and working, are definitely facing a lot of stress. Uh, uh, Chronic stress itself can cause the muscles to go into spasm or the muscles to be really tight. For example, I remember that when I am stressed, my shoulders actually go up like that. So my muscles become tight and contracted, and I end up having my facial pain or muscle pain in these shoulder muscles many of the time. So managing stress is also an important thing for our daily life, but also for treatment and for prevention of this kind of long-lasting muscle pain. People should identify when they are mentally stressed in their life and should take the necessary precautions. When I say necessary precautions, basically, there are certain things that you can do to reduce your anxiety levels and to reduce your stress levels. And all of those have been listed out previously in our YouTube channel. So there are a couple of videos created by Dr. Divya, who is the psychiatrist in Optima Hospital, and those mention very nicely how you can handle how what common people can do to reduce stress or anxiety in their daily life. So managing anxiety and stress is also an important part of the uh, uh, treatment or prevention of muscle pain, chronic muscle pain. So that is about what can lead to myofascial pain or chronic muscle pain. But how can somebody know? For example, somebody who's watching this YouTube live, they want to know whether the pain that they're experiencing is myofascial pain or not. So, what are the symptoms of myofascial pain? How do we recognize whether the pain that we have is a myofascial pain, Dr. Pushpo?
Yes, sir. So the in a myofascial pain syndrome, the pain what you see will be like a persistent muscle pain, which will be in a nature. Nature of the pain will be very deep and the dull pain, and that pain gets worsened with the activities and with the stress. So that can be the like I would say the different uh, than the other pain that when you do the activities or you are in a stress, you will feel the more pain. And the another part is the when you have the myofascial pain syndrome, your joint range of motions restrictions you can observe, You can observe the joint stiffness and the muscle tightness, and they have specific the referred pain pattern. Referred pain pattern, I when I say that means like the trigger points we have in the muscles. So that trigger points, it's a very sensitive area in a tight muscle band. When you press it over there, you feel the pain is referring down. So that is called the refer pain. So yeah, you can see here. So there is some test we do for this. So to find out where you have the trigger points. So I would say these 5 points are the symptoms, main symptoms for the myofascial pain is one is a persistent pain, the pain which will be in the nature of the dull and a dip, and there the pain which gets worsened with the activities, and you will find the trigger points on your muscles, and the tightness on the muscles, and there will be the restrictions in the joint and stiffness. So according to me, these are the symptoms I have observed in all the patients with the myofascial pain syndrome.
That is true. That is true, Dr. Khushboo. Thank you for listing out the features of myofascial pain so nicely. But many other conditions, such as osteo, which is basically a degenerative joint disease of old age, fibromyalgia, which is a pain processing problem, all of these can also cause pain. So one of the ways which in my clinical practice also, and one of the ways in which I tell other people also that one way in which they can recognize whether they're having myofascial pain is this knot that they tend to feel in the muscle bands. And this is acutely related to what is probably happening inside the muscle as well. So, as you can see in this diagram, basically the muscle fibers, there will be a contraction, so they will become tight, and that is what we can feel as a trigger point, and that will appear as a very taut band, a very tight band with a knot kind of thing. So, and the way in which this can be differentiated from other diseases like fibromyalgia, which can cause pain, is trigger point pain or myofascial pain reduces with massage, local massage, whereas local massage can worsen the pain many times, especially in patients who have fibromyalgia. So this is an important thing which can help people to recognize if they actually just feel their muscles or somebody else feels their muscles, they'll be able to feel multiple knots in them. So suppose a person has uh, muscle pain and they have felt their muscles and they feel that kind of knot, they can feel that. Uh, how can the physiotherapist help them? What is the role of the physiotherapist, Dr. Kushbu?
Yes, sir. So in physiotherapy, I would say the myofascial pain syndrome when patient comes, before we know that whether they have myofascial pain syndrome or not, the all physiotherapists will go through the basic assessment. So in that assessment, we will evaluate whether they have myofascial pain or not, or do they have the any other conditions. So we have different tests and the assessment for to diagnose myofascial pain syndrome. But out of that, these are the basic techniques where we assess the muscle tightness. We find out whether they have any postural issues and the tightness or the muscle imbalance. How is their muscle strength? Based on that, we identify the postural problems, and we can palpate the specific trigger points or surrounding any inflammations or swelling if they have. Along with that, we check the joint range of motions. So if suppose depends on the affected area, the how is their ability of the joint movement, whether looking down, looking up, looking on over the sides or the side bending. So these are the examples where we check the movement of the joints. So that could be the evaluation part. Based on that, we'll make a diagnosis that whether they have the myofascial pain syndrome or not, or any other condition. So based on the assessment, we will move forward to the treatment part.
So in treatment, of course, medications have been found to be helpful in two ways. Medicines for the treatment of myofascial pain is something which I prescribe many patients, but I always tell them that the main treatment in myofascial pain is conducted by the physiotherapist. So the non-medical or the non-medicine related treatment in myofascial pain seems to be much, much larger than the medical or the medicine related treatment. And medicines for the treatment of myofascial pain are generally divided into two categories, right? The first category is for immediate pain relief for patients who are having severe pain. As you were saying, that when they have severe pain, they'll not be able to move their neck or they'll not be able to move their joints. So in those kind of situations, sometimes it's very difficult for patients to do any kind of exercise, even if the physiotherapist recommends them to do the exercise. So there, these kind of pain relief medications are quite helpful. They reduce the pain, make the patient comfortable, and help in uh, uh, patient exercising. The second category of medications are, you can say, in the nature of preventive medicines. So there are medicines which we can give, and they have been shown to reduce the chances of developing myofascial pain, or even if you have already have myofascial pain, then they have been shown to reduce the help with the healing or treatment of the myofascial pain. So these medications are something that you need to be taking on a daily or a regular basis. So the second group of medications are medicines which usually act on the nerves and they reduce the tension in the muscle. So the most commonly used or the most commonly studied medication is a tablet known as gabapentin, but there are several other medications which have been used for myofascial pain. So broadly, the medical treatment of myofascial pain is divided into immediate uh, pain medicines, which can reduce the pain immediately, and other preventive medicines which you take regularly and which basically act on the nerves by reducing the tension in the muscle. Now, as I said, pain relieving medicines are very, very useful for controlling the pain and making the patient comfortable. However, before we go on to the next topic in this discussion, I just want to point out that some people tend to abuse pain medications. So they tend to keep taking just the pain medicines again and again and again and again. So if you're having to take pain medicines again and again, whatever the cause might be, it means that you have a chronic problem, chronic meaning a long lasting problem. So in that situation, it is better to take preventive therapy than to take pain medicines again and again. And preventive therapy not only includes tablets but also includes exercises under the supervision of a physiotherapist. So that is something that I want to point out. uh, Now, once we have identified the condition and we have given the patient the necessary medication, what will be the next step, Dr. Khushboo? And from the physiotherapy point of view, is there any differentiation like this, like something which helps with to relieve the pain immediately, and something else which helps to prevent or treat the pain over a long period of time?
Yes, sir. Yeah. So, in a role of physiotherapy, I would say, depending on the severity and the symptoms, we have the different techniques and the different type of I mean, therapies which we can use. So, first, I would like to say, as you can see here, there is something called manual therapy for the myofascial pain syndrome. So, what is a manual therapy? Manual therapy is a something hands-on technique where we have a different type of a techniques. So out of that, one of the technique is a joint mobilization. So joint mobilization is a where whichever the affected area, based on that we can mobilize your joint. So that can helps you to regain your joint mobility. It helps you to reducing in a pain uh, that is a joint mobilization. So another technique we have, there is something called trigger point release, where the physiotherapist can put a pressure over the trigger points and release the trigger point to reduce the muscle strain. And another technique we have, there is something called soft tissue release. So all the muscles have their specific origin and insertion. So based on their mobility and the flexibility, we try to release the soft tissues, so that can also help you in instant pain relief. So these are the techniques like a joint mobilization, trigger point release, and soft tissue release is a manual therapy which can help you reducing in a pain, improving your mobility, and getting back to your good flexibility of the muscles. So this is a part of a manual therapy. When it comes to the next, there is something called we do dry needling also. So to reduce the uh, trigger point and whatever the muscle nodes you feel, so we do the dry needling for that. That very thin needles we can insert and that can break down the muscle nodes and that can help also to reduce in a pain and improving in your muscle structures.
Okay.
Um,
So
yes,
these are used for immediate relief of pain.
immediate relief.
Okay. So so when uh, uh, dry needling is done, can you just describe, Dr. Khushboo, what
Yes,
is dry needling and is it something which is very painful?
no,
Because
sir.
it looks a little bit painful when
Yeah.
you describe it or when you show pictures like this. Some people
This
might
is
think that it is a
yeah.
painful procedure. So what
This
happens during dry needling?
Yeah, this is an invasive technique, but there is a very thin needles. If we insert, we don't even realize it's like a hair, like a thin needles, which we put it in a muscle wherever we find out the trigger points. We just pull out the muscles and put the needles inside and try to break out the trigger points and the nodes around it. And it's not really painful technique. You will not even realize when we do this that the needle has already inserted in a skin. It's we try to release this more of a superficial muscles. It doesn't go deep inside, so it's not a painful technique.
And many times I have patients who say that, I've already tried when I tell them that you should do dry needling, they say, I've already tried acupuncture. So here I just want to point out that acupuncture is totally different from dry needling. Acupuncture is based on an old Chinese medical concept where they release humor. So they just insert the needle just below the skin. Whereas dry needling is done by a proper trained therapist who can feel where your knots are in your muscle, and they insert the needle into the muscle and they insert it not only one time, after inserting it, you move the needle in and out. And the theory or the what scientists feel is that when we move the needle in and out, then little bit of blood is released into the muscle, and that blood itself has a lot of chemicals like PDGF and all, which might help in the healing of that muscle knot and relieve the stress or tension in the muscle. So this is one very important thing. So acupuncture cannot be considered the same as dry needling. Dry needling is a totally different procedure which is done by a trained and qualified physiotherapist or by a doctor, where a very thin needle is inserted into the place, the trigger point or the knot that you have in the muscle, and then the needle is moved so that a little bit of bleeding occurs in the muscle. Now, before we go on to the next topic, there are a few questions which have already come in, and uh, we can just answer them now. Shushma has asked, what are the main symptoms of myofascial pain syndrome? So I think we covered that, but for anybody who's joining late, Dr. Khushboo, can you summarize again in uh, just
Yeah,
a
so
few
the
sentences?
primary
What are the
symptom,
main symptoms? Yeah.
yeah, main symptoms of the myofascial pain syndrome is, as I already described before, it's like a persistent pain, which will be the pain, nature of the pain will be like deep and dull. It won't go like after trying all the possible basic treatment and all. So it's a chronic and persistent pain. Then the pain will be like you will find out the trigger points on your muscles and the referred pain pattern, and the pain gets worsened with the activity and stress. So this is the one of the primary reason that symptoms I would say that you can find out is your pain get worsens with the activity and the stress. You will find out the lot of joint stiffness and range of motion restrictions in your muscles and the joint. Along with that, you can see this is what referred pain, joint stiffness, persistent pain, and you have the deep, dull, and worsening with the activity kind of a pain. So these are the common symptoms.
And I think Jeevan did not catch the part of our discussion where we discussed about the causes of myofascial pain. So I can list them out. Jeevan, the myofascial pain, as Dr. Khushboo was pointing out, I think she's made a slide also regarding that. Um, So, four very easy to remember causes. So, poor posture, poor ergonomics, which also means poor posture, either at work or at home, right? Muscle weakness or imbalance, like one side of the muscle. Whenever we move our hand, for example, even if I lift my shoulder like this, there is one group of muscles which is reducing in size or contracting, another group of muscle which is relaxing. So if there's an imbalance in how they work, they have to work as a team. So if there's imbalance where one muscle is too strong and one muscle is too weak, then also you can develop this. Anxiety and stress is a very big cause of long-term muscle pain or myofascial pain, and sedentary lifestyle. So these, to summarize, these are the four important reasons why or causes of myofascial pain syndrome in adults and children. Um, Chitra has asked, can myofascial pain syndrome be prevented or it can only be managed long term. So, do you want to talk about prevention of myofascial pain, Dr. Kushbu?
Yes, sir. Yeah. So, yeah, coming to the treatment part again, that what could be the prevention and long term, how it can help. So, I would say the exercise, depending on your severity and the symptoms, there is a different type of exercise which can help you to reduce in a pain. So, we have like basic stretching exercises. Then we have there is something called the mobility exercises, and then we have something called the strength exercises. So, stretching exercise and mobility exercise depending on the affected area. Here, considering the neck pain, I have pictured these exercises. So, basic stretching can help you to improve your muscle flexibility. Then, the mobility exercise, which can help you to improve your joint mobility and the joint range of motions. And after that, it comes to the strength training. So, strength training, I would say, is a really important part. Whatever the kind of the functions and activities you are doing, for that your muscle has to be capable enough to do that functions. But if the muscles are really weak and if you don't have the enough strength for it, that muscle weakness can create again the muscle tightness. It can create the again the trigger points and the muscle pain. So I would say strength training is the one of the long term treatment for to reduce the pain. Manual therapies, dry needlings, and the other all the treatment can quick fix your pain. But the strength training is something, if you develop the good strength in your muscles, will help you to reduce your it will help you to do the functions in a better way. So yeah, here we have there is something called self-care techniques. So these are the tennis ball and the foam roller. You can use and massage over the sore muscles and the tightened muscles. Different areas we have the different techniques. So this is what you can do the self massage by yourself. So these are the techniques also can be used to reduce the muscle pain.
Thank you, Dr. Pushpa. So that was, I think, I hope that answers your question, Soumya. With respect to treatment options, Dr. Khushbu spoke about immediate pain relief, which can come with manual therapy, and then long-term treatment. She had suggested all of these exercises, starting off with stretching exercises, and then mobility, and then strengthening exercises. And also, she had mentioned about how there are self-treatment options. But when we come to medical treatment, I had also mentioned that there are two types of medicines, tablets for immediate pain relief, and then other tablets for long-term prevention of the pain or the problem. Chidambar has asked uh, what psychological or emotional factors tend to worsen myofascial pain and how is that involved in the treatment? So, thank you for that question, Chidambar. Um, as we had discussed, stress and anxiety are two things which can definitely worsen myofascial pain and in fact cause myofascial pain in the first, can be the primary cause of myofascial pain also. in the first instance. And the treatment in this situation becomes about identifying it, asking the patient, and then referring them to the correct mental health professional. Of course, just like Dr. Khushboo mentioned, that there are some self-care techniques, right, where you can use the tennis ball and massage the sore muscle, and that itself can reduce the tension and reduce the pain. Similarly, there are self-care techniques for management of stress and anxiety also, and all of these are listed out. For example, Shavasana or JPMR it's called Shavasana in yoga. Or with respect to breathing technique, there's something called as boxed breathing, 555 breathing. So all of these are listed out in other YouTube videos that we have created. I would ask you to please log on to our YouTube channel where there are at least two videos on how to manage anxiety and stress, and I'm sure they will help you in case you're facing these issues. And uh, Shashikala has asked, do we get giddiness from myofascial pain syndrome? So I think I can answer that question. No, Shashikala, we do not get giddiness from myofascial pain. Giddiness can occur due to various reasons, but primarily or commonly, I can say that the balancing part of our ear, inner ear, when there is a problem in that, that is when we have giddiness. But you can also develop giddiness if you're having heart problems or brain problems. So, but the most common cause is due to a problem in the balance center in the ear, and it does not have anything to do with any muscles. So therefore, myofascial. But Dr. Khushbu was talking about referred pain. So it's very interesting that you might have a tense muscle or a trigger point over here, but then you might have the pain all the way over here. So in fact, headache can occur, especially the side of the head. A headache can occur due to myofascial pain. However, giddiness is not a common symptom. Um, Dr. Vikas, Mr. Vikas asked that how can myofascial pain occur in patients with arthritis and how is it managed? So yes, myofascial pain can occur in patients with arthritis, and the way that I manage it is I refer the patient to Dr. Khushbu. So, that is why a team approach is very important, because just because the patient has arthritis doesn't mean that all the pain that the patient has is due to arthritis only. um, Patients with arthritis can also develop, of course, arthritis itself can increase the amount of stress that you have, because patients with arthritis are at higher risk of developing anxiety also. So, definitely, just because you have arthritis doesn't mean that you will not have pain due to any other reason. And myofascial pain is unfortunately common in patients with arthritis. And there are several patients, at least one or two per day, who in whom the arthritis is well controlled, but they say that their pain is persisting. And when I examine them, it's usually due to a myofascial pain. And those patients, I refer to Dr. Khushbu for management. In your opinion or in your experience, is there any difference with respect to the treatment or management of myofascial pain which occurs in people with arthritis versus in people without arthritis, Dr. Khushbu?
Yes, sir. So that is what depends on the assessment part. Due to arthritis, how much their joint mobility has restricted, or if they have the inflammatory arthritis, in that cases we cannot go with the manual therapy treatment and the dry needling and all part, but we can definitely try to release the muscles and try to make them more active with the exercises and doing a strength training for the particular individual areas. So it won't be the major change, but that will heal their arthritis problem also. If we are treating for the myofascial pains, by strengthening the muscles, by making the joint mobility better and improving the muscle flexibility, eventually they are working for their arthritis and better for that result as well.
I agree. It'll help them. It'll complement their medical therapy. And that is interesting that I did not think about it in that way. You're right that when patients who have active arthritis, it becomes very difficult to use manual therapy in them. So that is definitely a challenge. So we've covered about what myofascial pain is, basically a prolonged pain or in a muscle that many people tend to experience. We talked about what are the main causes of myofascial pain, which is usually related to anxiety, stress, or due to sedentary activity, due to poor posture at work or at home, and due to imbalance in the strength of the muscles. In addition to that, we talked about treatment, which includes not only medical treatment, and medical treatment can be divided into treatment which is taken immediately for pain, and then treatment which is given regularly for prevention of the problem. But in addition to that, there is non-medicine related treatment, which is managed by the physiotherapist, which includes manual therapy or trigger point release, which helps with respect to acute pain, meaning for managing the pain which is there. But for preventing the or treating the problem, we need to treat with exercises, which usually starts with stretching exercises and then move on to mobility and then strengthening exercises. So many times when I refer patients with myofascial pain to you, Dr. Khushboo, the patients usually, you know, come once and then they feel relief in pain, right? Uh, After that, do you tell them that, this is just for a temporary relief and for long-term relief, you need to come for the regular exercises? Is that something that is highlighted every time?
Correct, sir. Yeah. So I do tell them that by doing the manual therapy and the releasing techniques, you will feel good instantly. You will feel better. Maybe your pain will disappear within a 1 week or 2 weeks of time, but it can reoccur anytime if your muscles are not enough capable to do the functions, or your muscles are really poor in a strength, and if they are weak, that reoccurrence of pain will be there. So many patients I have seen a lot of times when that they have came before their pain has reduced. They were doing exercise for the 2 or 3 weeks, and again they have not continuing the exercise, and again the same pain has appeared. So in that case, to long run, I would say, yeah, doing the exercise, going with the strength and conditioning plan, or enough strength training. So we have the different sort of programs where we can focused training we can do for the muscle pain and the muscle strengthening. So that can help them to build up the good stability and the strength.
Thank you, Dr. Kushbu, for summarizing that so nicely. Another thing that I like, as you mentioned, muscle weakness, either due to sedentary activity or due to imbalance. Muscle weakness is a very big problem which can increase the risk of developing myofascial pain in patients. And one of the big drivers, one of the few big drivers of muscle weakness, apart from sedentary lifestyle. Sedentary lifestyle is the biggest problem, but apart from that is hormonal changes. So many women, when they go through pregnancy, when they go through menopause, there's a lot of changes that occur in their body, and that can result in significant weakness of the muscles, which is of course worsened by the sedentary lifestyle that we all tend to live nowadays. So those are people who are probably in that phase of their life, they're more likely to develop these kind of muscle pains, women who are going through hormonal issues. And believe me, consulting a physiotherapist can make a huge difference to your quality of life. In addition to that, men many times tend to be very over enthusiastic in the gym and especially focus on a particular group of muscle that they want to build up for cosmetic reasons to look good and all. And that might end up lead to a lot of imbalance in their muscles. And that can also increase the risk of them developing myofascial pain or chronic muscle pain. So it's always worthwhile that when you're on a fitness journey, better to take the help of a qualified specialist like a physiotherapist to make sure that you're developing the muscle strength appropriately and properly, and all groups of muscles are being involved so that you don't go on later on to develop any kind of chronic muscle pain. So I think we have covered most of the topics. Dr. Kushbu, anything else that you want to emphasize to the general public?
No, sir. I would say, yeah, definitely we have covered almost the topic. Other than I would put one point is like posture correction as we have discussed before. So, doing a proper posture alignments and managing your stress, being proper, educate sleep and the hydration also can help you to maintain this. I mean, the basic techniques which you can use for myofascial pains, you know. So,
Okay.
yeah, I think that.
So I don't think we have any more questions. I think this was a very useful session. I hope the information in this has been useful to everyone who is watching and who watches later on. If you have any further questions, please remember to put it in the comment section, and we will definitely try to answer it, even if it is at a later time. So, with that, I would like to end this session and thank Dr. Khushboo. Thank you so much for being part of the session.